We really, really recommend that you have all of your clinicians get the malpractice insurance, because if, God forbid, anything happens with the patient at the home, now you have like barriers of, malpractice in case of like lawsuits for liabilities and things like that. Hi, everybody. This is Mariam Treystman from the Home Health Consultant, and today we're going to talk about the credentials that go into a field staff HR file. But first, if you like our content, please like, subscribe, and share. So, credentials for field staff. This is the stuff that you need from them. Whenever you're hiring a field staff employee, whether it's an employee or a contractor, or even somebody through a staffing company, you are going to need this set of documentation to prove their ability to service patients and provide quality patient care. These are the minimum requirements, regardless of where in America you are, to be able to provide services. These are conditional, and also every accreditor requires this stuff. And so let's go into the basics of the credentials that need to be in a field staff HR file. So first things first, you need a resume or some other indication of work experience. In California and probably nationwide, the field staff that service your patients in home health and hospice need to have their license for about 1 year, for 1 year or more prior to working in a home health or hospice setting. This is likely due to the unsupervised nature and unassisted nature of home-based healthcare. If a field staff like an LVN or a physical therapy assistant or a physical therapist are working somewhere on site in a facility that patients come to, they're going to have a lot of support staff, supervisors, and other kind of support situations around to help them in case they have questions or if they need assistance. In home health and hospice, you're on your own. You're on your own at the patient's home. A lot of times at the first visit, you don't really know what you're walking into. You don't know what the family situation is going to be like and things like that. And so you can't, just walk into those kinds of situations the day after licensure. It won't go well, and people need to have some clinical experience under their belt to be able to do that. The resume and job experience is what proves this. And of course, the time from the initial kind of receiving of the license. While a resume is preferred, you could also have them fill out their job experience or work experience and educational history, whatever, on a form if you have it. Either will fulfill the requirements, but you do need some kind of basic like education and work experience history, just to make sure that they have worked in the position before. The next thing that's going to be important is a driver's license. Now, are there situations in which a field staff employee or contractor can not have a driver's license? Yes. Sure. But the job is to drive around town to different people's houses. Now, of course, they can have a driver or Uber and taxi around, but that's really unlikely and uncommon. And so you need to have a driver's license on file. Another kind of driver's license adjacent moment is you need to show proof that they have car insurance. There aren't really specifications about the level of coverage and things like that. You just need to have car insurance in the HR file. Again, if that clinician is driving around with a driver or with like taxi, Uber, whatever services like that, then absolutely you can bypass driver's license and car insurance, but it's really unlikely and rare that this happens, and you would need to get that in writing from them or just some kind of indication of this. The next item that you need to collect from field staff is their professional license. So this is the license of their discipline, whether it's an RN, LVN, PT, PTA, OT, OTA, whatever, whatever their, whatever their discipline is, you need the licensure for that. The only thing that excludes from this is the social worker. They are not licensed. They can be licensed if they're an LCSW, licensed clinical social worker, but a lot of times MSWs will do the job as well. And this is like a social worker with a bachelor's or master's degree. In that case, you need their degree copy. However, in previous years, field staff would give you a physical copy of their professional license. And so at renewal time, you will get the new professional license. Nowadays, in California, there's an online kind of there's an online search database as a public record that you can search any licensed person's credentials. This suffices instead of a copy of the physical card, and actually is a better indicator than the copy of the physical card, because like 1 month after receiving the physical card, that licensure can be revoked due to like whatever, a million things. And so verifying their professional license online, if that's available in your state, is the best case scenario either way. But this is going to vary state to state, so please mind your state practices. In California, we no longer ask for the physical copy of the card. We just go online to search.dca.ca.gov, and it will show like anyone who's licensed for anything, whether it's like a contractor or like anything. You can check that licensure online at that website. CHHAs will have a different kind of licensure, which you can also verify online. In California, again, we are not asking for physical copies of their license anymore. And actually, it's not really a license, it's a certificate. That's why they're called certified home health aides. And so that website is cvl.cdph.ca.gov. When you go there, you can search any person who works as a CHHA, and their information should come up. Both, whether it's a professional license or a certificate, this needs to be verified at expiration, which is usually annually. Also, you're going to need a copy of their CPR card. Anyone who touches a patient or goes to a patient's home needs to have CPR certification. The certification for CPR sometimes expires in a year, sometimes expires in 2 years, kind of depends on the kind of CPR you're getting. The only specification about this is that this cannot be an online CPR class. The class itself can be online, but the demonstration needs to be in person. And so online CPRs are not accepted at survey for field staff clinicians. You also are going to need malpractice insurance for the clinician. This is technically optional and not a requirement on a federal level. However, it's highly recommended. We really, really recommend that you have all of your clinicians get the malpractice insurance, because if, God forbid, anything happens with the patient at the home, now you have barriers of, malpractice in case of lawsuits for liabilities and things like that. Malpractice insurance is $100 or maybe $200. It's not that expensive a year. So it's really not a big deal to get for someone who's a clinician. And I think the website is NSO. The company is NSO something. So if you just search NSO malpractice insurance, clinical malpractice insurance, it'll come up. Next, we're going to talk about the health requirements. So first and foremost, you need a physical. The physical needs to state, at a minimum, that this clinician is free from communicable diseases and is able to perform their duties. Of course, you can have additional things on your form, whatever it is that you feel like you need to have, or maybe the doctor has a specific form that they use. But really, this is the wording that we're looking for, that they are free from communicable diseases and that they are able, health-wise, to perform their duties. The physical has a timing requirement. It must have been done within 6 months prior to 2 weeks after the date of hire, or in the case of like a staffing company, it needs to be in that range of when they see the first patient with you. Please be conscious of this because, just like with licensure, you can be free from communicable diseases today and then not free tomorrow. So you really want to maintain these timings. Of course, we can't error proof this, to 0 errors. Like, they're not going to go get physicals like once a week, but maintaining just at least a 6-month window from employment really helps to make sure that the field staff clinicians are safe in a health perspective to see patients. Next, you need tuberculosis clearance. This comes in the form of either a PPD or a chest x-ray. Now, if someone has ever tested positive for a PPD, they no longer qualify for the PPD test and will have to do the chest x-ray. A PPD needs to renew annually, as does the physical. The physical also has an annual kind of expiration, and so every year you need to get that renewed, or the field staff needs to get that renewed. The PPD also is only good for 1 year. However, chest x-rays are good for 2 years. If the staff member is getting a chest x-ray, you need a copy of the x-ray. It's not enough for the doctor to just fill out the form. Not like a copy of like the photo of the chest, but like the lab printout or the whatever x-ray printout. Some places don't, or some field staff don't want to do chest x-rays due to the radiation. If that's the situation, it is allowed, and check state to state. Everything we're saying, check state to state. Also, this is like really federal guidelines, and I'll throw in some California things here and there. But it is allowed to have somebody do the chest x-ray at coming to, like, when they're starting employment with you, and then from there annually fill out like a TB clearance self-assessment checklist, indicating that their tuberculosis is not like flaring up pretty much. This is an annual requirement if that's the route you're going to take. But, we're in healthcare. I understand radiation concerns. And so like, I'm not here to scold or talk down to anyone's health concerns, of course. But as a clinician, you are seeing a lot of different patients, usually who have vulnerabilities with their health care, might have like immunosuppressions and things like that. And so it's just like, it's kind of a good idea to get that chest x-ray, more often than not. And lastly, we have a hepatitis clearance. You're going to need this hepatitis clearance, again, annually. And there are some vaccinations also that people will need. But that's going to really, really depend on your state and things like that. As you know, nationwide, there's just federally a big push for everybody to be annually flu vaccinated. But there are people who just don't want to get vaccines. That essentially becomes a QAPI kind of moment for your company with like various education and things like that. But ultimately, you can educate all you want. If a clinician feels uncomfortable with this, like, I don't know what the state requirements are in your various states, but there's always kind of a push and pull with this specific thing. And it is not like a requirement in that you won't get a deficiency if someone's not vaccinated for flu every year, but it's definitely something that's always reviewed at survey, that there's a lot of processes around and things like that. So that's it for field staff credentials. Of course, there are additional things that are required in the HR file. Of course, your company can go above and beyond or require additional certifications, this and that, especially if you have somebody like specializing in something or, whatever. But these are like the bare bones of what's looked at in an HR file from a credential standpoint at survey and what's required for you to maintain. So again, I'm Mariam Treystman from the Home Health Consultant, and this was the credentials needed from a field staff for their HR files at hire and how to keep track of them, renew them, whatever. If you like our content, please like, share, and subscribe, and thank you so much for listening.